Welcome to the Just Medicine video series on double mastectomy, scientific data and medical evidence. At Just Medicine, our goal is to provide the scientific evidence which guides medical treatment and recommendations. We hope that it will unlock insights for women with breast cancer to make the right decisions about their surgical therapy to live longer and live more. In this series, we will review the data comparing the outcomes of bilateral, or double mastectomy, with unilateral or single-side mastectomy, and breast conservation treatment, or BCT. The scientific evidence will be presented in 3 videos. We will be discussing survival outcomes in this first video. Surgical complications and quality of life will be reviewed in the second and third videos respectively. In addition, we will have a bonus video to learn about the experience of survivors who have undergone surgical treatment for breast cancer. Please note that this is solely an educational video and is not intended to replace a surgical consultation. Do see your doctor to review your specific circumstances and for treatment planning. Here, we present the data, which form the basis for surgical recommendations and trust that it will help patients make the right decision for their treatment. Let us begin. In preparing for this video, we scoured social media for netizens who did logs about their journey through breast cancer treatment, and found a few common refrains. We highlight 3 of them here. Quite a few women wished that they knew they had options before undergoing mastectomy. These women also advised others to obtain more information about treatment and to do their own research on medical literature. Dr. Tan hopes to fulfill these objectives in these videos. She will now discuss this topic in further detail. As there is much research data to present, please feel free to pause the video if you wish to take notes or verify the references listed.
Thank you everyone for joining us in this video. As mentioned earlier, we will be reviewing the scientific data in medical literature for women with early-stage breast cancer and who are eligible for breast conservation treatment, or BCT. Women who have a tumor no larger than 4 centimeters and fewer than 3 lymph nodes involved with cancer spread are usually considered to have early-stage breast cancer and suitable for BCT. In addition, these patients should not have a gene mutation that places them at an increased risk of recurrence, and they should not have any medical reason to avoid radiotherapy. Although there are many options for surgical therapy for women who are eligible for BCT, for purposes of our discussion, we will classify them into 3 broad categories. The least invasive or the most gentle approach would be to perform breast conservation treatment. This procedure is also known as breast conservation surgery or lumpectomy. Next, the patient can elect to do either a unilateral, which is a single-sided mastectomy, or bilateral mastectomy. Following mastectomy, a woman can choose to have reconstruction. Again, there are many methods of reconstruction, and it is best to consult a plastic surgeon if a patient chooses to undergo this operation. Having said that, our intention here is to review the overall outcomes of women with early-stage breast cancer who undergo one of these 3 operations: BCT, unilateral or bilateral mastectomy. Before proceeding further, we would like to take a short pause here to explain the medical term that is often used for bilateral or double mastectomy. The process of performing a second mastectomy is referred to as CPM, which is the abbreviated form of contralateral, meaning the opposite side from the affected breast, prophylactic, being done as a preventive measure, and mastectomy, which is the total removal of breast tissue. In the case of CPM, the opposite breast is removed without evidence of cancer prior to surgery, usually at the same operation as the mastectomy for the affected breast. Hence, when a patient undergoes CPM, it often means that the patient would have undergone bilateral or double mastectomy. In this article, the authors observed that there was initially an increase in the rate of breast conservation surgery after a consensus statement issued by the National Institutes of Health in 1991. However, over the past decade, up to the time of publication of the article in 2016, there was a shift towards mastectomy and CPM. This was corroborated by another study which showed a significant increase in the proportion of women with stage 0 to stage 2 breast cancer undergoing bilateral mastectomy from 2003 to 2010. The rising trend was particularly pronounced in women who were 45 years and younger. Researchers sought to understand this phenomenon of a rising trend of CPM, as there was no evidence of improved survival with bilateral mastectomy, and it is not recommended for women who are at average risk of recurrence and are eligible for breast conservation. After careful work over several years, researchers have uncovered these as the main reasons for choosing contralateral prophylactic mastectomy, or CPM. Of the many reasons why women choose double mastectomy, this team of researchers led by Dr. Mann highlighted the following. Women wish to reduce their risk of having cancer in the opposite or contralateral breast. This is medically true, however, women may have to consider the risk they place themselves at to achieve this goal. The risk may exceed the benefit, as we will address in a later video. On the next 4 points, there is no clear evidence that these concerns will be alleviated with CPM. One issue that I agree with is that women may not be given a balanced view of the risks and benefits of CPM, and this is what I hope to do in this series of videos. This is a study using information from a registry database. The researchers analyzed the survival outcomes of 41,510 women. The team of researchers found that bilateral mastectomy did not provide any breast cancer-specific mortality benefit over unilateral mastectomy. There is always the question as to whether other studies have shown different survival outcomes. In fact, I think there might be. This study, led by Dr. Kurian, published earlier in 2014, reported slightly different survival outcomes comparing bilateral and unilateral mastectomy in favor of bilateral mastectomy. However, they also found that breast conservation treatment, or BCT, resulted in similar outcomes to bilateral mastectomy. Presenting mortality as a hazard ratio or proportion of deaths in the treatment group, there was a suggestion that BCT may result in lower likelihood of breast cancer deaths. But this did not reach statistical significance. I would like to highlight that this study was done in 2014. Since then, there has been increasing data to show that women with early-stage breast cancer who undergo BCT have better survival outcomes than those with mastectomy. This evidence is presented in another video series, Secrets of Breast Cancer Surgery, and you may wish to review the data there too. For now, we will return to the subject at hand. Having considered all the scientific data available to date, recently this expert panel of doctors convened at the European Breast Cancer Conference and published a manifesto on the use of contralateral prophylactic mastectomy. They made several recommendations. However, I would like to focus on one in particular that is related to our immediately preceding discussion. It is their combined opinion that for women who are not at high risk of contralateral breast cancer, ipsilateral or same-side, breast-conserving surgery is the recommended option. We now know about the data and expert opinions supporting breast conservation treatment over bilateral mastectomy for women who have early-stage breast cancer and are not at high risk of contralateral breast cancer or cancer in the opposite breast. Experts recommend that women focus on treating the existing disease first and delaying the decision for contralateral prophylactic mastectomy until after treatment is complete. In our next video, we will move on to the potential surgical complications and risks that are associated with double mastectomy and how that compares with breast-conserving surgery. This is also on the list of recommendations made by the expert panel. Let's chat again soon.
Thank you for staying to the end of this video. Please feel free to email us or submit a request for more information on our website if you have any questions. Don't forget to subscribe to our channel so that you can be notified once our next video is uploaded. We look forward to sharing more insights with you in the next video. See you soon!